So why don't we begin by having you tell us what Feng Shui is and what it has to do with being a mom?
Okay, well, Feng Shui is the idea that the energy around us and our physical environment affects the energy within us. And as a mom, we are even more sensitive to what's going on around us because, especially during pregnancy and that fourth trimester, the first 3 months of motherhood, we are so vulnerable because we are giving so much to our child, and it's really important to have harmonized energy. And so with this, I take it obviously beyond just the physical environment and think about how the energy and our mind and our body and our spirit, how those are harmonized and how those can enhance our life.
And I found it interesting that you included the fourth trimester, which I had never heard of. So will you talk a little bit more about why that's a trimester?
Yeah, absolutely. Because I think for a lot of women, that is almost the most difficult phase. Of course, the kind of interim period of childbirth itself is very, very intense, but that fourth trimester, the mother is hit with so many unknowns. She is getting to know not just this brand new human who might seem like a stranger at first, but she's getting to know herself as a mother. It can be a really shaky period. And a lot of books, a lot of childbirth preparation courses, they end right after the placenta is birthed. It's like, okay, great, go home, good luck. And I remember feeling like, I don't know what to do. And luckily I had a really great mother that could support me through that, but I had so many questions. So I felt like it was really important to nurture the woman beyond the birth of her child and in those first 3 months where everything is shifting and it's so new.
Yeah. And tell us what inspired you to write the book.
Yeah, so I was teaching childbirth preparation classes, and I would teach it very much by the book, but as I started to get feedback from clients, I learned that there was a lot of gaps in what I was teaching, and they really wanted more. And a lot of these women, myself included, when I was pregnant, read tons of books and still felt like something was missing. And judgment was also a really big piece of it. A lot of the mothers felt that different books or courses judged them for their choices or told them you have to have a natural childbirth, or why not just have a medicated birth? You're silly to put yourself through that intensity. And so I wanted to find or create something that was really welcoming to all women, regardless of whether they wanted a natural birth, the medicated birth, a cesarean birth. I've had clients that needed a cesarean birth or elected it for various reasons, and I really believe that all of those women deserve to be represented and supported. And so I actually had clients ask me, why don't you write a book? And at first I thought they were crazy. And then the more I thought about it, I really felt like I did have a book in me for pregnancy and childbirth.
And what would be your best piece of advice for a woman who just found out that she's pregnant?
Breathe. Breathe and then just give yourself a beat, because so often we discover we're pregnant, we start doing. And we forget to just take a moment to look at the big picture of that and to really think about it and connect to the fact that we're pregnant, what that means for us. And before she gets into all of the actions, really start to marinate on what feels right to her in regards to a childcare provider and the type of birth she wants. Because sometimes we make rash decisions based on what we've been told or our past stories about pregnancy. And I kind of did that in a way. I was like, well, I'm having a hospital birth because that's what I know. But I think if I would have taken that beat, I might have gone down a different path.
It seems like empowerment of the woman is a central piece of what you're teaching.
Yeah, empowerment to really trust yourself, because so often we look outside of ourselves for the answers. And with the book, of course, I want to give information that is needed, but a big piece of it is showing the woman how much knowledge she already has inside of her. Connecting with that intuition is a big piece of the book, and I feel like through the process of discovering the intuition, learning to honor it, that's where a lot of empowerment comes from.
Yeah. And what would you say to someone who is really afraid of giving birth, of the actual birth process?
That is okay, and that is totally normal. I think sometimes we hide that fear because we think it makes us look weak or like we don't have courage, and I think it is so normal to have that fear. But to also know that there are ways that you can start to dissolve that fear. One way is through knowledge, just kind of learning about your body, figuring out what exactly you are afraid of. I have a whole chapter in the book about fear because it is such a big and powerful creature. And to not think that there's, again, anything wrong with that, because I think sometimes when we label that fear as bad, then it's like us against the fear versus seeing it as a piece of us that we just need to work with.
Yeah. And what about advice for when the baby's here and it first arrives and you're entering that 4th trimester?
Yeah, I was just talking about this with a client the other day who felt that right after her baby was born, she just immediately went into that mom mode and thinking, okay, I need to put the baby on my chest. Do we need to breastfeed? And going back to what I said before about taking that beat, I think it can be really neat after birth when you've done so much and you've exerted so much energy to even just take a second to breathe before bringing your baby up to your chest and being really gentle and slow with yourself in that getting to know you phase, because it can seem so fast that the woman feels like she doesn't have time to transition from pregnancy to motherhood. And you can take some space in there to allow your baby to enter your heart and your body and
just honor the transition.
Yes.
Yeah. And what do you most hope that women will take away from your book?
I think one of the main things is knowing that they can trust themselves and that they can trust that their instincts in most cases probably are right during pregnancy, childbirth, and especially motherhood. I feel like so many of us think how am I going to be a mother? I mean, especially women that maybe didn't have a really strong role model. But they really do have so much strength and knowledge within them. And if they just trust that and allow that to lead the way, then they can really have a really empowering journey through motherhood, which lasts a lifetime.